Hello, welcome to some hot topics from the October board, which we held at Rampton Hospital last week. We had a fantastic piece under the heading of Patient Voice, which was a recorded interview with one of the women in the women's services, who gave a really moving testimony and account of the care that she'd received whilst she'd been in the hospital over the last 3 years, and some of the background and context of that. And it was really moving to hear how she'd been helped and her talking about her aspirations from the future. And it's a great example of how we can sometimes, as a board, lose sight of the fantastic work that goes on across all our services, but not least at the moment at Rampton Hospital, who are under the spotlight for obvious reasons following the recent CQC report. So thank you specifically from the board to all our staff that are involved in those services, which have received national awards, but also more broadly to staff everywhere that are involved in managing people when they're probably feeling at their lowest and at their worst, often working in really challenging environments to create space, optimism, hope for recovery. And it was a really good start to the board last week. So develop that theme a little bit in relation to the CQC. So as you know, the results from recent reports from their inspections have been a bit disappointing, and I wanted to emphasise that when I use that word, it's very much about a disappointment with the rating. Wherever I go on my visits to see teams across all of the trust, I'm forever meeting fantastically motivated staff who are really an inspiration about their dedication to helping people move forward. And the disappointment is that at the moment we're unable to reflect that when we get inspected by regulators. I'm really optimistic and confident we can move forward in that domain and start to evidence much more confidently the great care that we're providing. Next is a piece about some of the initial improvements we're starting to see in some of our performance. So we've had some real challenges across many domains in the trust, not just our trust, but both within the region and nationally. Services are really under the cosh. One of our particular challenges of late has been around the use of what's called out-of-area beds outside of the county, and we've been a national outlier in that. And for the past month or so, that I think the tide is starting to turn, and that's a great testament again to staff really focusing on some of the specific issues and moving the services forward to help meet the needs, to intervene earlier, to support crisis intervention. That's been backed up by some additional investments in services too. That has been a particular millstone around our head, not around our neck, not just in terms of poor quality of patient care, but financially. And this is, again, a really uplifting piece of improved performance. Similarly, there's some fantastic work going on in the urgent and emergency care sector. Staff teams at Lings Bar and in those pathways as patients step down from the acute hospital have really improved performance. And again, it just enables us to create that space to do the transformation and support staff to deliver care closer to home, away from acute hospitals, which is better for everybody. So thank you for that. Wanted to finish with just a piece around our equality and diversity agenda. I've hosted a couple of sessions over the last few weeks at Connecting Knots. We had a really positive Black History Month conversation, and we had a prolonged session at Board Development looking at these issues. Quite rightly, they're challenging conversations. I think it's really important that we have them. I don't think there are quick fixes, and I think the national environment at the moment is quite challenging to work in, but it's critically important that we are able to create a culture within our organisation that is inclusive, where everybody feels able to make a contribution and make a difference. I'm keen that it's not that we don't have a plan that's written by me or the executive team. Everybody can contribute to it. So I'd really welcome people's comments on this as we expand the conversation out and continue to improve our performance in this really critical area. So finally, thank you for listening. To finish off, we are bracing ourselves for winter. You're all aware of that. It's on the national media. Flu is increasingly prevalent. I hope you've had your jabs. And we will support people to do as well as we can over the winter period. Thank you very much.